Our program was funded in 1999, and we started screening in 2001. Even now, there's still a lot of women that doesn't know that there is a colon breast and cervical cancer early detection program. And even, I will not say even literacy level, low literacy level, even those with degree still refuse to do their screening.
Ethnicities residing in Palau would tell us that the reason why we don't come and access the program is we always thought this program is only for Palauans. For some Palauans, they would say that we know about the program, but we just don't have time.
One of our barriers is our cultural taboo. Sometimes they don't want other people to know that, they're sick, they don't want to come to the hospital. If a lady comes in for screening and she sees one of her relatives, she won't go to the clinic because it's against our custom.
So how would you approach on that kind? That's a challenge to us, right? It doesn't stop you from doing what you are doing, right? From reaching out to them, from educating them, from giving them more information. That's why it's really important to have data-driven information given to the public so that they will know how important it is to get screened. That's one aspect that you have to intensify in Guam, public education. If you can change someone's behavior to give an informed decision about their health, that's really fulfilling for me.
See why we have to spend our time going to the community and do the screening and not following up on these people. Then what's the point of screening? The reason why we wanted to go out to the community and screen is to identify these people and bring them in. We go out of our way to make sure that woman comes in for their appointment. It's hard to work with those non-compliant patients, but we always remind ourselves, tell ourselves that let's not get tired of these people. Let's make sure they really come in for their appointment.
We are looking at a health equity framework in which we are trying to make sure that the Asian American Pacific Islander group is also equally represented in who we are trying to reach and get screened.
We know now that these women are getting screened. It's the same as reaching women everywhere. We're trying to save lives. So it doesn't matter where they live or who they are or their ethnicity. It's a woman and it's her life, and we want to make her have the best life that she can.
She helps a lot of women, especially being a Marshallese doctor. She speaks the language. The underserved ladies, they cannot speak English. And then when they see a Marshallese lady being a doctor, then finally we have a Marshallese doctor. We can communicate well with her. She's very devoted, committed to the program, advising them that how come you're not coming back. If a patient comes in, with problem, she'll be asking, why now? What took you so long to come? Your life is very important.
When she was diagnosed on 2016 with a stage 4 rare invasive cancer, she never gave up. She still continued to work despite treatment, in between chemo. She would always say to us, I still have a mission to do, to bring back selfless love to the community. As I promised to her, continue the work that she was doing. Her vision is, please don't miss anyone if you can. Don't miss anyone to be screened in our program.
When she go to churches or the communities, she talk about her experience when she had cancer. People really listen to her story and what she went through with chemo, and people actually come in for screening after listening to her. We go out there for outreach. We keep these promotional items. They just took them. But then comparing to survivor talking about their experience, people actually listen. They come straight to the clinic. She doesn't want any, other to experience what she went through. And she convinced ladies to have mammogram or have come to the clinic for clinical breast exam. She really tells them that, what I've gone through, I don't want you to go through it. I'm hoping that there will be no more cervical and breast cancer. The HPV vaccine, we also collaborate with immunization, going to the school and making sure that these little girls, they get vaccinated.
No.
30 years from now, I think maybe there will be less cervical cancer. I hope we are free from cancer.
My hope for the next 30 years in the program is to be able to utilize all the resources given to us from CDC or other programs to develop a sustainable systems and processes to make sure that these women are screened and to screen them before it's too late. So that's my hope, to have them take charge of their own health.
This job is really something that entails a lot of dedication and passion. There's always unity in our work. I believe in the saying that in unity there is power, and in power there is change. When you envision a change, you have to be united with that vision, work with that vision, and together you can make a change out of it. Yeah.